My name is Gabrielle Sanders. I am here with my mentor, Mary Catherine K. Sticks, and I'm about to ask her questions about good stretches and exercises. Okay, what are good stretches for knee injuries?
So the two best stretches for a knee injury would and it does depend on the injury, but you have two main muscle groups that kind of work or affect your knee, and one is in the front of your leg, the quads, and in the back of your leg you have your hamstrings. And so those are two great stretches to do. To stretch your quads, you have to bend your knee up as much as you can so you can lay on your stomach and try to bring your heel to your bottom as much as you can. You'll feel a very strong stretch in the front of your leg. And then to stretch the hamstrings, you do the exact opposite. We want to straighten your knee out as much as you can to stretch your hamstrings, so you can lay on your back and take like a strap and pull your leg up and try to straighten it out all the way, and that will help stretch the back of your leg, your hamstrings.
Okay. What is a good time to hold a stretch?
So we say hold all stretches for 30 seconds, and you're going to do it 3 times, like repeat it 3 times. Why we do that is because to hold it actually 30 seconds is going to allow the muscle time to stretch, and then by doing it 3 separate times, we're actually going to make an effect on that muscle to actually let it lengthen and elongate.
How long do you wait to move from stretching to exercises?
So I love that you asked this question. Stretching is part of an exercise. So under the category of exercises, we have strengthening exercises and then stretching exercises. And you can really do both from the beginning. Just it depends on what type of stretching and strengthening exercises you're doing. We have different movements. We have passive, which means you're not moving. Someone else is moving it for you. We have active assistive movement, which means you're moving some and something else is helping you move it a little bit. And then totally active is you're moving all on your own. So some stretches, like for the knee, for example, right after knee surgery, if you're not able to move a certain muscle, we can still bend the knee for you on your own. But a lot of times you're also able to use certain muscles. So like we may do a quad set, and that's strengthening the quad, but also kind of helping stretch the hamstring. So you kind of get a 2 for 1.
Okay. If a patient doesn't say anything, how do you know where to stop when stretching without hurting them?
So a lot of times it's by feel, okay? So we call them infields. We have different infields, and depending on what we feel in that infield is kind of how we know when to stop. So you're looking to feel it kind of as like, say you were on your stomach and I was trying to push your knee to your bottom or your heel to your bottom. As I'm bending that knee, as the muscles are getting tighter, I'm having a harder time pushing your knee. And so some we learned in school, some I learned just on the job, the feel of what I'm feeling, but that is how.
What kind of equipment do you use for stretching?
Lots of different things. We in the clinic use what we call a stretching strap, but at home I tell people they can use dog leashes or scarves or towels or belts to kind of mimic the stretching strap, but that's mainly what we use in here. We also, for your calves, have something we call a slant board.
How do you determine how many reps and sets to do?
So it depends on what the exercise is and how hard the exercise is. If I know, well, first of all, I always try to tell people is that we're doing this exercise as far as strengthening because you're weak in that area. I'm finding your weakness in it, exploiting them. I'm purposefully picking hard exercises for you to do. If it was easy, you shouldn't be doing it. So depending on how challenging I think it is how I'll say. A general rule of thumb is 3 sets of 10, We break it up into sets of 10 because if you just did 30 straight through, the chances of you actually thinking about what you were doing for all 30 is not good. So by stopping in between, you have to at least reset your mind. Okay, what am I doing? Let me start that again. But if I was having you doing something laying down, that's a lot easier than an exercise standing up. So I might do only one set of 8 standing up versus laying down. But that's kind of how it depends.
How do you determine the difficulty level for a patient's training?
A couple of things. One, I look how they are doing in therapy, but we can look at their strength and their range of motion. We can kind of take those measurements, and then we can kind of gauge what the difficulty needs to be. But also, we look at what they want to return to doing. So if this person is just, a walker every weekend and they only walk a couple miles every week, and we don't need to get them to be able to run and jump and hop because they're not doing that anyway. So definitely looking at what they're doing helps with that.
Do you ever do exercises or stretches with your patient?
Yes. I do. Well, the slant board. Every time I get on the slant board, I'm like, ooh, my calves are tight. So I always try to demonstrate the slant board for the patient, even if they've done it 1,000 times, because I love hopping on that thing to stretch my calves. And then so stretches, I'll do the slant board, but not really anything else. The strengthening exercises, I definitely will do with them to kind of show them proper form, because if you're not doing it right, not worth doing.
How do you ease the pain for a patient?
So we have several modalities. We call them modalities. That's what they're called. That we can do, and there are different reasons we do the modalities, but a lot are for pain control. So we can put a hot pack, a moist heat pack on you to help decrease your pain, and what that does is that increases the blood and helps the tissues relax. We can also put a cold pack on you. The cold helps decrease your pain by actually constricting your blood vessels, so the swelling and stuff goes out of wherever you're swollen, and kind of helps with the soreness after therapy. We have something called e-stim, so that's electrical stimulation. We have different currents with that help ease the pain. And then we also have something called a game ready, and that is cold and compression. So when you have swelling, especially post-operatively, we'll do that and elevate the leg and help get that swelling out of there. So those are the main things to help ease the pain.
Thank you.
You're welcome.